Yes, he's 8 days old. Yes, he's a high-risk anaesthetic, but I have no choice.
On this week's Bondi Vet Top 5.
You happy?
Struggling to hear.
That's her again.
Yep. Okay, that's good. Okay, so just put her up to 2. This is why anaesthetics are risky.
His heart's just going through the roof.
It's very concerning as a vet when you see an old dog that needs a lot of procedures doing. Anaesthetics are always risky.
This week's number 5.
Hey, Charlotte.
Hi.
Okay. Is this the new recruit?
It is.
Oh my God.
In Richmond, Scott's day is beginning with one of the youngest and tiniest patients he's ever seen, an 8-day-old Chihuahua puppy.
Puppy.
Brought in by a very worried owner, Charlotte.
He was born with a cleft lip and cleft palate.
Oh my God.
Let's just have a look and see. Oh, wow, okay.
The deformed palate means every day of the little Chihuahua's life has been a struggle.
Oh, sweetheart, you're already looking hungry, like you're trying to eat your hot water bottle.
Because he can't latch on to either his mum or a bottle, and he isn't putting on weight.
At birth, the vet stitched up all the roof of his mouth and stitched up the hair lip, and the hair lip's just not holding. He's had to be restitched 3 times already. Something more permanent has to be done.
With the temporary suture out, is he able to suckle at all?
No, he can't. He hasn't got the vacuum that's needed to get the milk out.
Yeah, I mean, look, he's already hungry, you can see. Aren't you, mate?
There's now only one option left, more surgery, but this time under anaesthetic. A risky thing for such a young dog.
Let's go into the consult room and we'll chat about this very fraught surgery we're gonna have to do on you, little man. Come on then. I have absolutely no choice. I need to perform surgery today. Yes, he's 8 days old. Yes, he's a high-risk anaesthetic, but I have no choice because without performing this procedure, he can't latch onto mum, he can't suckle milk, and unfortunately, he will end up starving. Well, this type of patient and also this type of surgery is incredibly fraught and not something that we want to do. But in his case, if he doesn't have the surgery, he will basically fade away and starve to death. Yeah, the other possibility is that he can also aspirate the milk, breathe it in and die suddenly. And you've only had him for 8 days, but I can tell you're quite smitten, aren't you?
Yeah, he's stolen my heart. Absolutely in love with him. He's like a member of the family already. And I've been hand-rearing him for the last 8 days. I'm so in love with him already.
Well, I'm gonna take him downstairs and see the team. Say goodbye to your little man.
Good boy. General anaesthetic for an 8-day-old puppy's never good. It's never something you want to do, but it really is his last hope. I'm just scared that he's not going to make it.
Hi, guys.
Hiya.
Right, so we've got a difficult job in our hands today, guys. So we're really going to have to keep our wits about us because you can just see the size of that hair lip.
Oh my God.
Yeah.
It's really sad.
But now, unfortunately, the temporary sutures that were put in at birth, you can see, have just blown. And now he just can't clamp down. He can't just get the suction that he needs to suckle properly because you can see there's actually a little tiny, tiny, tiny little hole just there, like a pinhead. But still, it'll be too big and he won't make it. So we do need to perform an anaesthetic and surgery on this guy.
Nurses Nathan and Reagan will assist with the challenging task of anaesthetising such a tiny patient.
It's an anaesthetist's nightmare, that is.
Yeah, well, I think it's anyone's nightmare.
Yeah, you know, a young animal, old animal, we all know that they are the riskiest.
And he won't make it if we don't do this. All right, let's start the process. Just a little bit of anaesthetic. Everyone cross your fingers and toes and paws. Because we have to do surgery on his head, we can't have his head in a mask.
No.
So when we get down to a point where we think that he's deep enough, we're going to quickly flip him around, okay? And then, Reagan, if you can extend his head, and then I'm going to hold down his tongue and try and get the tube in, all right? First task to be tackled is to try and navigate the anaesthetic. Can we place a tube down his throat? Can we place a tube in his nostril? Let's give it a go. So you're going to pull the mask off and you're going to spin him around to me, okay?
Ready?
3, 2, 1, go.
Scott is hoping a narrow tube down the throat will be the most effective way to administer anaesthetic to his tiny patient.
Puppy.
But it's proving more difficult than he thought.
It's a tiny little head, he has a really big tongue and gets in the way of our ability to look and see the larynx and pass that tube through. Yeah, just going to have to gas him down a bit more, it's too light. What is he on now? Is he on 5?
4, it's a 4.
So put him up to 5. I think what we'll do this time around is we'll just try straight onto this. So we'll go into his nose, try this. Because he's so small, he's got such a fast metabolism. So he's quickly removing the anaesthetic from his system. So he's giving us such a tiny little window to perform this microsurgery. It is really proving tough. Okay, let's try again. Attempt number 52. Not sure, but maybe. I know it's so difficult to tell, but can you see the bag moving, Reagan?
No. Oh, wait, actually. It's like it's sort of working, but not completely.
Yeah, so I'm going to take that out and we're just going to try the mask. Right, sweetie. Okay. Okay, so the new plan is basically can't get the tube down and he doesn't seem to be tolerating the nasal tube either, so we're going to keep him nice and deep. You're going to just put it over his nostril. I'm going to scrape. We're going to put it back on.
Okay.
All right. The pressure really is on Nathan and Reagan. They're the ones that are responsible for the anaesthetic, maintaining that and ensuring that he recovers from it. So it is quite a high pressure procedure. He's a tiny puppy. So I'm just going to scrape the edges, okay? And then we'll put him back in the mask. When we're all happy again, and Nathan, you think he's deep enough, then I'll be putting the sutures in.
Okay.
All right? All right, let's go for it, everyone. Ready? 3, 2, 1, go.
With the anaesthetic now finally working, Scott can clean up the pup's lip and at the base of his nose. He can then place sutures to permanently hold the edges together.
Okay. Ready? Yep. So just take our time, control our nerves, and we'll go back in. His heart's beating nice and strongly throughout, so in as much as it's not very nice to hear him cry, it's better that than him not survive. So a little bit of pain for long-term gain. Sorry, baby boy. You have to do it one suture at a time. Puppy. Never had to do surgery in bites of 5 seconds before.
No, this is crazy, but...
It's got to be done.
Yeah.
Yeah, difficult. Just need to keep telling ourselves we're doing it for the right reasons. He won't survive unless we do this, so I'm sure he'll thank us eventually. Just if we want to do the right job, I know that it's tough, but I think we need to just put one more suture just on the inside. So if we gas it down one last time, then that should be it, okay. So after the speed surgery and those little windows that I was able to place the sutures, I'm actually really happy with the cosmetic result, and we're done. The lips have come together. I feel that now he will be able to produce suction in order to feed from mum, and hopefully he'll go on to grow up to be a nice little Chihuahua puppy.
Bless him.
He makes the cutest noises, doesn't he? Oh, man, he wouldn't go to sleep, and I feel like I need to now. That was tense. We've put 3 sutures in exactly where they need to be. He now has a nostril. He now has a fully formed hard palate. The fact that he fought us so much on the anaesthetic, that he was screaming blue murder at points, just shows his character, and that will really bode well for the future of this little guy. Yeah, gotta love him. We did it. Here he is.
Upstairs, it's been an agonising wait for owner Charlotte.
So literally just out of surgery, and it was very, very challenging, but he is as tough as nails.
Now you can see why I wanted to do it.
Yeah,
He's got such fight.
he really does. So we'll be taking the suture out in, well, maybe 10 days, 2 weeks. We'll see how it goes. We've put a non-absorbable one in there, so it will stay for as long as we feel it's necessary.
Brilliant.
Until he's just a bit stronger and a bit bigger. But right now he's done great.
I think you need to name him.
Why don't we call him Cliff?
Cliff.
Yeah.
Yeah. Now to get him home, get him on mum, get him feeding, get him back to bright and alert like he normally is.
You guys better get off. He needs to go and have a drink, and I think you need one too.
Yeah. Agreed, thank you.
All right then, Charlotte. Take care, sweetheart.
And you, bye.
Bye, little man. Oh, someone's home. Hello.
Hi.
Oh, wow. A little handful of cute there.
A few days later, Scott is making an important house call to check on tiny cleft palate patient Cliff.
So that's proud mum Dolly, yeah?
It is, bless her.
Hello, you about to feed your babies?
Cliff's holding his own with his brother and sister. He may be the smallest in the litter, but he's certainly not the quietest.
But I can see at the same time that those sutures and just the abnormality that he's suffered with is going to mean that long term he is going to struggle to latch on and consume as much food as his brother and sister. So I would suggest that we do kind of supplement him with a little bottle from time to time.
Definitely. Funny you should say that.
Ah,
I think you should do the honours with this one.
Oh, yes, please. Look at this. Hey, there we go. Oh, you're going to have some? It's a really wonderful, special moment when you get to bottle feed a puppy because they are looking at you like their mum. They're pouring at you with their feet, trying to sort of pressurise the milk as if they were latched on to mum still, and it's a very special moment for me. Well, I think if this feed's anything to go by, he won't be long before he's catching up with his brother and sister.
No.
Hey, little man.
No, no time at all.
Hey.
Number 4.
So now I'm down here in Cornwall, it seems like word's got out a bit that there is a vet for hire. So I've just had a phone call from a wildlife enthusiast who's got a couple of patients that he wants me to take a look at.
Morning, sweet cheeks. Breakfast. Hello. Who's a good girl?
Gary Zammit is the head ranger at Feed and Farm, which is dedicated to the care and protection of indigenous UK wildlife.
Good morning, Rodney.
He's invited Scott today to help with 2 of his rescue rooks.
What are you doing?
The great thing about rooks is they're intelligent, they're extremely affectionate, and they're one of our really beautiful native birds in Britain.
Hi there, Gary.
Hello,
How
nice
are you?
to meet you.
Good to meet you. I'm Scott.
Cheers.
And who's this awesome creature?
This is Rodney. So this is
Rodney.
one of our rooks that won't need any of your attention today.
Yes, well, he's looking
fine.
very healthy. I mean, it's very clear. Rooks are part of the crow family, aren't they? With magpies and ravens and things.
Yeah, that's right, yeah. And so they're very, very smart, aren't you?
And normally, you think of them as a wild animal. So why is this guy on your wrist?
Well, they're all rescues that can't be released. So this one was actually found when a tree blew down in a storm, and he was the only chick found alive. And so he was reared from a tiny baby. So he's totally what we call imprinted, so he thinks he's human.
Hence the human name.
Yes, hence the human name, Rodney.
Yeah.
You're handsome, aren't you?
Will you come and say hi to the vet? Will you? Oh, you're taking a little nibble out of the vet. Well,
Put your hand
luckily I'm not
behind
here
him.
to see you.
Put your hand behind him, he'll probably step up.
Hello, mate. Wow, he is gorgeous, isn't he? All right then, Rodney, you're going to come and introduce me to the team? Yeah? Should we go? Come on then. Come on then, buddy. Come on this way. Here we go. Come on. Hey.
Hello, guys. Hello, sweet cheeks. Come on then. What have they got for you?
The first patient is a rook called Sweet Cheeks, who was rescued after living most of its life in a cramped cage.
So here they come. I can just go. Good girl. Gotcha. Good girl. I can have a little tea towel. Just cover her eyes.
Yeah.
That'll calm her down a little bit. Sweet Cheeks is probably one of the worst cases I've ever seen. When we got to the house to collect her, the whole place was absolutely filthy. There was a cage jammed in a dark, dingy room with cats climbing over it. And when we got her out of the cage to have a look at her, we saw the deformed beak, the deformed legs and feet, and she was just a mess, basically.
But I can see that malocclusion there and that they're not actually lined up correctly, which is why we're seeing this knot wearing down.
Mm-hmm.
Okay, we just need to trim that end off, don't we?
Yep.
Poor girl. And just whilst we're there, can I just have a look at these feet? Oh, bless her, look at those. They really are mangled, aren't they? Poor little Sweet Cheeks, hey? Deformed beak and then this incredible disability of these 2 club feet, but it doesn't seem to be affecting her. She's eating and happy just like the other ones?
Yeah, she took a long time to settle in, mainly because she was terrified to leave the cage that she'd lived in for 8 years.
So as this one's the one curling over the top, clearly it's not touching at all on the floor, which is why they're growing so long. But I quite like to have a cue as to how long a natural rook's nail is. So I might just see if Rodney wants to come and help me with that.
Okay.
Come here, mate. Do you want to come and model your feet? Never thought you'd be a foot model, did you? Good boy. That's a good lad. Right, let's have a look at your nails. Okay. So just looking at little Rodney's nails, they're about a centimetre and a half or so. So that's a good guide for sweet cheeks, isn't it? Yeah, it is. Yeah. Do you want to do it? No? Okay, I'll do it. All right. Okay, good boy. Say to about there. Try that. Okay, good. So poor little Sweet Cheeks is suffering with these very long nails because she's got these very deformed feet. She's had an awful life up to now until she's come to be in Gary's loving arms. And the toes are very deformed. And so the nails aren't wearing naturally on the ground or on perches. And as a result, they overgrow, which is why we need to trim them. Good. That's good. I'm happy with that. Rodney, what do you think? Hey? I think you probably could have done better. Hey, all right. All right, so now for that beak. About there. What do you think? All right, Sweet Cheeks. That's it.
There you go. I know, it's okay.
This side is really off to the left here, so all that is just deviating off to the right. Clearly just not rubbing the way it should. Rodney, I'm trying to work.
He wants attention.
I'm nearly there. This is twinging my perfection gene, so I just want to make her beak look absolutely perfect. It does look so much better already. Look at that. Ta-da!
That's better, isn't it? Oh, I know.
What do you think, Sweet Cheeks?
I think that's Rook for unimpressed.
Yeah, I don't think she's impressed at all, are you? Good girl.
Good girl. Well done. All right.
That looks a lot better.
Oh, clip nails, sorted out beak so she can go.
Good girl.
Girl, well done.
Come on in. Easy, easy, easy. There you go. Oh, that looks better, doesn't it?
Oh, thanks, Rodney, for the present there. Hey, didn't they say something about it's good luck to be pooed on by a bird? I think that's what people that haven't been pooed on say. Yeah.
Ow, that's not very nice, Nelson, is it?
Gary's next patient for Scott is Nelson,
beautiful.
who has a far more serious problem with his wing.
There we go. Nelson was brought here by a lady who found him just running along a road with one wing drooping. And when she got closer, realised that Nelson couldn't actually take off. Nelson's wing just seems to have drooped more and more with time. And unfortunately, it's getting to the stage now where it's tripping over the wing gets tangled. And then you have the dilemma, do you just euthanize it or do you see what you can do?
Just have a good feel. So you've just been trimming the feathers just because she's been tripping over them.
Yeah, it just takes the weight off it a bit.
It just feels quite wasted, so sort of a section of muscles called patagium, and it's maybe it's been affected at some point, so rather than there being an obvious break, it's just weakness, and so the wing has just dropped down.
Yep.
But unfortunately, that muscular structure also contains nerves, and if the nerves are irreparably damaged, then unfortunately never will this rook be able to use the wing properly.
What I do think is that he suffered a neurological injury. There's something called a patagium, which is basically a sort of a thickening of nerves and tendinous structures that runs down from the shoulder all the way to the wrist joint, the metacarpal. And I wonder if he suffered an injury there, it's damaged the nerves irreparably, and now he can't move his wing properly.
Therefore, I would actually suggest amputation, removing the wing completely.
He's never going to be releasable. But I just feel with the wing gone, his quality of life's going to be better.
All right, let's put this boy in a box. And take it
Okay.
off.
There she goes.
Okay, Gary.
All right.
Let's go.
The reality is it might sound harsh taking a wing off, but the wing's doing nothing at all apart from making Nelson's life more difficult. And Nelson could have another 30 years or so. So we want to make those 30 years as comfortable as possible.
Scott will perform the delicate surgery with a new team at a local vet clinic.
Come on then, Nelson.
Thank you.
Sit.
Okay.
Let's go. Come on in. Hello, everyone.
Afternoon.
Hey, gang. Hi, I'm Scott.
Hi, Steve.
Hi, Steve. Nice
Hi
to
there.
meet you.
Yeah.
This is Gary.
Hi, Gary.
And this
Nice
is
to
my
meet you.
rook patient, Nelson, who needs a wing amputation.
Okay. I think Claire's in the prep room ready for you, so if you want to go through, it's perfect.
Great. All right.
Thank you very much.
Thanks very much. Come on, let's go.
I've drawn up the drugs ready to go there. All right, so ready to
Waiting to assist Scott are vet nurses Tash and Claire.
X-ray and then prep afterwards.
Well, hello.
Hi.
Hi, I'm Scott. How you going?
Hi, nice to meet you.
Claire, hello.
Hi, Tash.
Hi, Tash. How are you? So this is Gary.
Nice to meet you.
And Gary has a rook patient, okay? So Nelson needs a wing amputation. So if you pop him up there and say your goodbyes.
Okay. See you later, Nelson. Yeah, he's nice and calm.
Okay.
There you go.
All right.
Okay.
Take it easy. We'll see you on the other side.
Okay,
All right.
thanks.
Cheers, Gary.
Cheers.
Where are you, mate? There you are. There you are. I've got you. I've got you. It's okay. 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 Okay, I've got him. Shh. Yeah, got him. There he is. Isn't he incredible?
Yeah.
That, as we know, anaesthetics and birds can be quite risky. This guy seems pretty chilled, however.
It's really calm, isn't it?
He's really calm, and hopefully we'll all be cool, calm, and collected. One of the big things with bird anaesthetics is that we need to just do everything as quickly as possible because they're very delicate creatures. We want the anaesthetic to be short and we want them to wake up quickly. So everything needs to move at pace. So this smells gross, all right? But then you'll wake up feeling much better. Which that seems pretty good fit, actually. So I'd let you know when he's going a little limp. I'll know that because he's really got good hold of my finger.
Are you that in?
Yep, he's going a little limp there.
With Nelson now under anaesthetic,
Okay, all right, happy, Tash? All right, let's go.
Scott can get an X-ray of the bird's damaged wing.
That is just the weirdest thing I've ever seen. Where's this bit of bone gone, Nelson? Hey? I'm really perplexed by what I'm seeing because he doesn't have a part of his humerus. It is literally not on this X-ray. It's so unbelievably weird. I really don't know why or how that's happened. All I know is it's going to make the amputation easier because he doesn't even have bone to cut through. So happy days, but super weird. So, ladies, a little bit of a turn up for the books in that the humerus already has a gap in it. So I thought it was very strange when I was feeling it then, but that's clearly why he's not been able to use his wing because it's simply not attached to the rest of his body.
At least there's a good reason for it.
Yeah.
Right, brilliant.
Yeah, and it means less work for us.
Yeah, perfect.
Yeah. All right,
Okay.
I'm going to get changed into my vet gear.
Okay.
You guys keep bucking. All right.
Okay, he's stable. He's got really good sound, strong heartbeat. Regular,
Brilliant.
that's good.
Good.
You happy?
Struggling to hear.
Just pop the lid there.
Just turn the ISO off if you think so.
Seconds later, Nelson's heartbeat has dropped alarmingly.
You just go quite right round the side.
Just can't hear it. I don't know whether it's just my hearing, if it's that light.
As we're desperately waiting to hear from Tash so she can hear Nelson's heartbeat, just time starts to stand still and every moment feels like hours.
I don't know if I can just hear machines. Yeah.
Turn the ice off.
Just turn the ISO off. Anything?
Can you hear anything?
Now that Nelson's struggling under the anaesthetic and we can't hear his heartbeat, we turn the anaesthetic off. So hopefully he'll start to lighten up, but it does take quite some time before we can hear any heartbeat at all. Happy? Right. Okay. Unfortunately, my friend, I'd have much more finesse than normally, but this is not going to be my prettiest. I think Nelson was in a whisper of death, honestly. Like he was just so close to not coming back. And anaesthetics in birds are risky. So we'll just skin there. Okay, so this will be the sore bit. Oh.
Okay, right, I'm going to put him
again.
back to 3.
As I start to move forward with the surgery, Nelson's anaesthetic again takes a turn and he starts to wake up. Is that a mask?
Yeah. There you go. Right, go back in there, mister.
We react by increasing the anaesthetic and then he goes down again, but it's a hell of a roller coaster ride. Okay, girls. Okay, you ready?
Yep.
Here we go.
Okay.
Off.
Yeah.
Right. Okay, Claire, you still happy?
Yep.
So that's the last stitch, so let's wake him up. Oh, I don't know about you two, but I nearly had a heart attack doing that.
Yeah, pretty
stressful.
scary anaesthetics,
Oh.
yeah.
Wow, well, we did warn Gary. I don't know if we warned ourselves.
No.
Like you come. It's supposed to be the harbingers of death. We want him to see the light. Come back towards the light. Come on.
The shock sometimes that can kill them after the operation,
right.
which is the recovery is sometimes the more risky part, isn't it? Which is,
Yeah. Nelson.
Yeah, he's coming. He's coming.
Okay, mate, come on in. That was hellishly stressful. And honestly, I feel like we've literally saved this guy's life a couple of times during this procedure. And now, hopefully, if he comes through this anaesthetic, he's going to make a full recovery.
Yeah.
So I think we can all feel very proud. There we go.
His eyes are open.
His eyes are open. Look at that. He's a fighter.
Say hi.
Feel better now.
Hey, you must say thank you to the girls. Hey, thank you for saving my life. Hey? Hey, you've given all of us grey hairs. Yes, you have. A truly incredible experience has happened here in Cornwall with this rook because it was a very short anaesthetic on a bird that needed a surgery. It was absolutely right to do it, but to go through it with strangers and come out of it with 2 new friends and a rook that survived without the wing that it didn't need, it's an absolute miracle. So here he is.
Looking a bit smaller.
Yes. So the girls and I have just completed an amputation, so you can just see the site under there. The girls did an amazing job at plucking. So, and Gary, I've got some very odd news for you in that actually he was missing a piece of his upper forearm. So his wing wasn't actually attached to his body. It was only attached by skin and sinew and muscle. But the bone literally disappeared. I don't know where it is, but it's not in your bird.
All right.
But after some, shall we say, anaesthetic challenges, girls, we'll just leave it at that.
Yeah.
Anaesthetic challenges,
Right.
we've managed to get your boy through and we're just
Brilliant.
chuffed for you.
Oh,
We're very,
that's
very
brilliant.
proud of ourselves and of him. And now we want you to take him home and give him lots of love.
Brilliant. That's
All right.
lovely. Thank you.
Okay, let's pop you in. Good boy. All right, in you go, lad. In you go, lad. That's it. Good lad, good boy. Girls and I are going to the pub. Seriously, pub.
We've been promised a beer.
Yeah, at least one. You've earned it.
Brilliant.
Right.
Thank you.
Cheers, Gary.
Lovely.
Good on you, mate.
Thanks a lot.
All the best.
Cheers. Thank you.
We'll come and visit him. He's only up the road, so.
Yeah, please do.
Bless him.
Cheers. Thank
Bye.
you.
Okay.
All right then. Come on.
Bye, Nelson.
Bye, Nelson.
Bye.
Oh, right. I'm never doing a rook anaesthetic ever again.
Nor am I.
Although, can I say, girls, high five.
Good morning, Nelson. How are you doing? There you go. Good.
Next morning, over at Feed and Farm, Nelson the Rook is recovering well from his amputation surgery.
You're looking good, aren't you? Have some breakfast.
Hey there, Gary.
Oh, morning.
How are you?
Yeah, good.
Right.
Yeah.
How's my rook patient doing?
Brilliant. No, really, really good.
Right. Oh, he looks fantastic, doesn't he?
Yeah, so much more comfortable looking now.
Yeah.
During a tense surgery, Scott had to remove Nelson's deformed wing.
Today, Nelson is looking absolutely fantastic. You would never know that he's been through quite the bumpy ride that he has, and he seems fighting fit.
That's it. And then there's that little suture line in there. Looking good. Very small, really.
Yeah, I'm surprised how small that wound is.
Right, mate. You can go and see your mates, hey? Go and find that girlfriend of yours, hey? Come on then, let's go.
Good boy.
Hello, team. Hello, Rodney. Hello, champ. Look, we got your buddy back. Look. Look. Hi. How are you this morning? Hello. Look. Look, it's Nelson. There he is. There's your buddy. There he is.
Yeah.
All right, Nelson. You go find your girlfriend now, buddy. Okay. And there he is. Fantastic.
It's great, isn't it?
Yeah.
So, yeah, that's his mate there calling now.
Gary, thanks so much for the opportunity to perform this procedure on your rooks and for sharing your passion, because now being with these guys just for couple of days, I can really see where that passion comes from. They're awesome.
That's great. No, thank you. I mean, Nelson there's looking great. He's going to be a lot more comfortable.
Yeah.
And Sweet Cheeks Beak's looking great. And yeah, it is amazing how once you spend a little bit of time with the species that you might not think much of before, it changes your attitude. And that's the whole point of what we do.
You all right, Rodney? Do you want to come home with me? You're pretty cool.
And he is a bit of a star, isn't he?
Oh, he's a ledge.
This week's number 3.
She was panting a lot. She started shaking. We got more and more nervous because she's just not herself at all.
Daisy's been brought in with a potentially life-threatening condition that's called pyometra, which is basically an infection within the uterus. Unfortunately, we do need to perform surgery on her. And Daisy is not in the best place for surgery.
Oh, my God.
Come on. Even despite our best efforts, she stops breathing. Come on.
Daisy, you're gonna be all right. She's gonna be all right.
In St Margaret's,
Gonna be
Royston and Laura have made an emergency appointment for their very sick pug, Daisy.
We noticed her a bit lethargic and she wasn't really herself. She was panting a lot. She started shaking. So it was sort of by early evening, we got more and more nervous because she's just not herself at all. So we need to get it sorted.
Hello there, guys. Hi.
Hi, Doctor.
Hi, Royston. How are you, mate?
Morning.
Hi, gorgeous. Hello,
Hi,
sweetheart.
Doctor.
You all right?
Well, not really well. These days, Doctor, not really well.
Hello, Daisy. Looking very sad. Panting a little bit. So you're not comfortable, are you, baby?
No,
Not at all. All right, well, we better get you in and have a look at you, hey?
All right, come on then, team. In we go. Daisy is a very much loved part of a family of 3 other dogs, and of course, Royston and Laura. They're incredible clients, they're wonderful owners, and they adore their animals. Well, let's have a little examination. I mean, the first thing I could feel is she's just like a hot water bottle, isn't she?
Yeah.
She's so warm.
Yes.
Yeah. And that's why she's panting then, and obviously a bit uncomfortable as well. So, okay, let me just have a feel of your tummy, my love. Stand up. Wow, yeah. So straight away I can feel just how tense her abdomen is. She's really bearing down, like as if she was about to give birth or pass a big poo.
Exactly.
But that's not been happening, has it?
No.
We thought it was a stomach problem in the beginning, like because she couldn't poo, but no.
And let's just have a look at her back end then. So yeah, I can see it's a bit stained back there. And when was it that she last had a season?
She had a season about 6 weeks ago.
Yeah.
So it's just,
And is she drinking more than normal?
yeah. She's drinking a lot more than normal.
Yeah. Daisy's been brought in with a potentially life-threatening condition that's called pyometra, which is basically an infection within the uterus. Unfortunately, we do need to perform surgery on her and remove this infected uterus.
Well, we have to, it's the only way to get her well. Go ahead, you take the decision, we follow you.
Pyometra can be life-threatening. It can make dogs really unwell, and sometimes they don't survive the anaesthetic or the surgery or even get to the vet practice. Now, I have complained and begged them to neuter their dogs sooner. They know that. It's something they're very concerned about because Laura in the past, being from Colombia, had some bad experiences with vets, found it hard to trust them, and Royston as well, incredibly nervous about the dogs that he loves so much, worried about the anaesthetic and will they wake up from it. So they have held off from doing a spay, but unfortunately that has turned around to bite them because if an animal's spayed, they don't have a uterus, hence they can't have pyometra. There's been anaesthetic issues in the past, there's been concerns regarding how your dogs have been treated in the past, that you've been so frightened of doing it.
Yeah.
But unfortunately, because of that fear, we're here right now, which is a real shame.
Yeah.
Yes. I've cancelled maybe 2 or 3 times the day before when she has to go for the operation to be spayed, just through nerves. I get nervous like weeks ahead of the time.
I know that you guys are super worried. I know that's the reason why we've been unable to get you in the building to do it, but it is something we desperately need to do, and now she actually feels unwell.
Yes, Doctor.
Come on then, I know you love them very much. I just need to remove that excess baggage is what I need to do. Yes. Say bye, Mummy.
Bye, Michael. We'll see you later on.
See you later.
Goodbye. We are worried, but in the same way, we think it's
It makes
fine.
me slightly less worried.
Yes.
In Scott's hands.
Yes.
But still very worried.
Yeah.
Very worried.
Sort you out, don't we, Kate?
Sweet.
Yes.
You all right?
Hello, how are you?
Good. Daisy's not so great, though. Poor little thing. She's got pyometra.
Oh,
Having your baby.
that's not nice.
So she feels like a little pug-shaped hot water bottle at the moment. So she's just not well, are you, baby? I feel for Royston and Laura because they feel very, very guilty that they didn't heed my advice about neutering.
Obviously, there's risks, but
Yeah, and also being a pug, as you know, there's risks on top of that. And then she's a sick pug, which is even worse. Daisy is not in the best place for surgery. She's panting, she has a fever, and also she's a pug, so she's not built for breathing very well. She's got a tiny little flat nose and a flat face. So all the issues associated with breathing in that breed, compounded by illness, means that this will be a risky anaesthetic.
Okay, sweetheart. We'll see you on the other side, yeah? Good girl.
We very carefully and gently move forward, giving her the minimal amount of anaesthetic needed in order to knock her out. Spin around. There we go, sweetheart. Good.
But seconds later,
Oh, God.
Daisy's in trouble.
Even despite our best efforts, she stops breathing.
Can you grab that drip bag and just bring it through?
Vet nurse Lily has been called in as an extra pair of hands.
can I just put this under a towel?
Yeah. Despite all my tricks of the trade and then even some drugs, she still continues to not breathe. But what's then worse, her heart starts to slow down. Daisy was in trouble. She'd stopped breathing, and with her heart slowing, we needed to make some very smart decisions very quickly.
Just get some adrenaline at the ready. Quick as you can, Sam.
I asked for some adrenaline to get her heart beating stronger, and we give it to Daisy.
Do you want to give her some IV?
Yep.
SpO2 81, going upwards.
Okay, heart rate's much stronger now.
Daisy's heart rate is responding well to the adrenaline,
So about 1 in 5.
but she's still not breathing.
Be in a good position. Come on. There we go. That was her.
That was her. That's her again.
Yep. Okay, that's good. Okay, so just put her up to 2. This is why anaesthetics are risky. This is why we want to do spays on healthy dogs, not sick ones. There we go. Her heart rate's nice and consistent now, so she just needs to breathe in that gas and then we should be in a good position. Well done, everyone. She's back now. Gosh, she took her sweet time, didn't she? My heart was in my gut because it is like doing a procedure on someone's child. Little Daisy here, and we nearly lost her. Yeah. It's almost where their concerns are realised, you know.
Yeah.
They were worried about an anaesthetic. Well, for the last 5 minutes, so have we. So,
I don't know if I breathed in that time.
no. My heart was down here. Although thankfully Mum was beating at times, Shez was trying not to. That's too much. Too close. And for people that, you know, talked about how much they trust you and how much faith they have in you, and then that happens, it's even worse.
Daisy's breathing is now stabilised, and Scott can begin removing the infected uterus that's making her so sick.
Okay, the size of it. So that's her left horn is just engorged with pus. Normally, a uterus of this size would probably be about a little finger, and that is much bigger than my little finger. It's massive. And the sooner it's out, the better for this dog. She'll feel much better, and so will I. Okay, I'm just going to snap the ovarian ligament now. that done. Sam, how's the dog doing?
She's, her heart's going well. It's what we like, isn't it, Daisy?
I'm doing mega speedy surgery because none of us want to be here any longer than we have to be. And we both want to get her woken up as soon as possible. So there's a nasty uterus. Yep, sorry.
That's okay.
As soon as the uterus full of pus is removed, that's a massive relief on Daisy's system. She's no longer absorbing all the toxins that pus is giving off. Here she comes. There we go. Now she breathes. Back to those huggy, abnormal breathing ways. To see this pug make those lovely puggy noises on recovery was music to my ears. Come on then, Trouble. Let's get you all snuggly. Hey.
Daisy will sleep off the anaesthetic and will hopefully be able to go home with owners Royston and Laura later today.
2 rules: heart keeps beating and lungs keep breathing. Yeah, deal?
At the St Margaret's Clinic.
She's showing off her breathing now.
Yeah, back to pug breathing yet again. Some sort of broken vacuum cleaner.
Daisy has fully recovered from the surgery to remove her infected uterus.
You don't even know, do you? What you put us through, all that stress.
Unaware of the drama during surgery, Royston and Laura have arrived to pick up their little girl.
Since we left, I've been a bag of nerves, just waiting for the phone call. As far as I know, everything went well. I guess we'll find out when we speak to Scott.
Hello.
Princess.
The main cause for her illness, which is that uterus full of pus, is now gone. But I'm very glad to have passed her back to you because she wasn't breathing initially when we gave her the anaesthetic. So the concerns you had regarding the anaesthetic were valid. But then her heart started to slow down a little bit, got a little bit fluttery and hard to hear. So we had to treat her with emergency medication. But thankfully, very quickly she came back round and she's here to send home with you now.
My heart just stops to think that it could have gone the other way, basically. It's a terrible thought.
Yeah.
But luckily, she came through and we got our baby back, basically.
Yes. Oh my
So
gosh,
it's a relief, a good, big relief.
Yes.
Yes.
Daisy will be kept on a course of antibiotics to make sure all infection is completely gone from her body, and then she should make a full recovery.
Oh, bye, baby. All right.
So
See you later, guys.
Thank you so much, doctor. Thank
All
you.
right. Sleep well.
You too. Thank
All
you.
right.
Bye-bye.
Bye. See ya. Bye.
In Isleworth, Scott is making a very special house call.
Well, hello, sir. How are you? Yeah, good. Hello, Daisy.
Hey, doctor. Hello.
It's 6 weeks since Daisy was rushed into the clinic with a life-threatening condition.
Oh, thank you. Oh, I know, to see the girl. Thank you. So, she put us all through the ringer. How's she been since the surgery?
Much better.
Say hello to the doctor.
Oh.
Daisy, oh, come on, don't be rude. Don't do that. You're supposed to say thank you for saving my life. She's run around more than before, so it's
She's
fantastic.
got a new lease on life by the sounds of it.
Yes.
Very good. Can I just have a little look at my handiwork there and just see how things are looking? Can I have a look at your tummy? Hey? Oh, that's healed really nicely, hasn't it? Beautiful.
I just want to say thank you from the bottom of my heart. Doctor, thank you so much. Thank you
So
for
welcome.
everything.
I know how much you guys love your dogs, and obviously this was one of those instances where you put off a decision to spay her because you were worried, and it actually made things a hell of a lot worse.
Yeah.
And now, the other 2 dogs, are we planning on
Yes.
booking them in?
Yes,
They will.
definitely.
100%. They're both going to get done.
Thank you. I think for your sanity and for mine, let's just get it done.
Yeah,
Yes.
for sure.
Yes.
100%.
They have to be done.
Sound good?
Oh, Daisy. Big cooker. Big
It's
cooker.
a very clear no. No more surgery. Go away.
Yes.
Oh my God, you are a grumpy bugger.
Number 2.
What's been happening with Harry?
His tummy got really swollen and it's sort of fairly hard to the touch as well.
I'm really worried it could be related to his heart, in which case it's an emergency.
Okay, I'm going to go get him.
While Bree collects Harry, Audrey prepares the mobile clinic so they can examine the elderly cat and make a decision on his future as fast as possible.
Good boy, Harry. Wow, that belly is huge. I know. He's using a lot of effort there to breathe, so that can indicate that he's having problems getting oxygen around, or there's a lot of pressure in his lungs from fluid.
Yeah.
It's not a good sign, mate. So that definitely does feel like fluid. It could be blood, it could be a whole bunch of things. Harry's a geriatric patient that we've been seeing for quite a while, and he's got a bag of problems. His mum is actually really unwell and is in hospital. She's got cancer. So we're really worried about her condition. We'll just take a sample of the fluid in there. Yeah. If I feel like it's worrying, we'll just take him straight to hospital.
Yeah.
It's all right, baby.
What are you getting there?
Lots and lots.
Oh gosh, that's really shocking.
Yeah. All right, so we're getting a yellow tinged clear fluid. Could be related to his blood pressure or his heart, or it could be a mass in there that's just causing all this fluid leakage. So get him to hospital, take some blood, check his protein levels, and scan his abdomen, look for a mass. There's a lot of pressure on us today because if this is a bad outcome for Harry, it's also a bad outcome for his owner, Jackie. She's in hospital fighting for her life, and all she cares about is Harry. So I really want to make sure that he's okay, so she'll be okay. New experience, isn't it? Ooh.
In Sydney, Audrey and Nurse Bree need to carry out urgent tests to find out the cause of 20-year-old cat Harry's badly swollen stomach.
I know. Is oxygen good? He really looks unwell. He's skinny, he's got this big pendulous abdomen full of fluid, and he's struggling to breathe. We need to find out where the fluid's coming from. Is it life-threatening? Is there a tumour in there? Is there infection? You are not well, my darling. I want to rule out conditions step by step. First step's going to be taking his blood pressure. I want to make sure that he hasn't got high pressure that might be causing the fluid to leak into his abdomen. 190. So 190, 200. So high blood pressure. That could be one of the reasons.
After discovering Harry has high blood pressure, Audrey is now taking a sample of his blood for testing.
It's all right. Good boy, thank you, Harry.
Right, we'll run that. We've done 2 tests already on Harry. The blood pressure showed that he was hypertensive, which means his blood pressure is quite high. That can lead to fluid in the abdomen. And now I'm just running some bloods to check in on his thyroid, his liver, his kidney, and also check his protein levels as well. See if there's any protein leaking out into that abdomen as well.
But Audrey's now worried the further extensive testing needed to get to the bottom of Harry's problem could spell disaster.
You're doing so well. You're so stressed, baby. I need to go really, really gently. Any stress, he might go overboard, struggle to breathe, and potentially die. Buddy, you're scaring me. Okay.
And suddenly, Harry's condition rapidly deteriorates.
His heart rate just shot through the roof.
Oh gosh.
Audrey and Bree are now fighting to save his life.
What is going on? I'm getting pretty worried because it's gone from a routine set of diagnostic tests to he's crashing. He's gone really unresponsive, his heart rate's shooting through the roof, and his oxygenation is dropping. I'm really worried that he's going to pass away right now. We may not make it through while we find out what's going on. His heart's just going through the roof. Buddy, you're scaring me. Okay.
In Sydney, Audrey and Bree are battling to save 21-year-old Harry after the ageing cat crashed during routine diagnostic tests.
The monitor looks worrying and he looks worrying. So I'm actually worried that he's going to pass away on the table right now. I'll just work around. Yep. So we start him on some oxygen, we take a step back and we cross our fingers that he restabilizes so we can continue.
Oxygenation's getting better already. Hello.
Hello, hello, don't do that again. After a while, Harry decides to use his 8th life. He comes back, he starts standing up, it's like nothing happened at all. I've never seen a cat just bounce from looking dead to suddenly becoming 100% okay. Big sigh of relief for us. I don't really even know what happened just then. I think he got a bit stressed.
Collapsed.
And then his heart rate just shot through the roof.
With Harry stable again, Audrey continues testing to find out what's causing his dangerously swollen stomach.
We know there's fluid in his abdomen and we take an ultrasound probe and we can see all of that fluid in there. So his bladder's still intact. Yep. All right, ready? I make a decision to drain some of that out because he's just so uncomfortable and I really don't want him to crash again while we're testing.
Oh gosh. Wow. I don't see any tumours or masses in his abdomen, which is good. Great. His bladder's still intact, so he hasn't ruptured his bladder. Okay. So this is coming either from blood pressure, from his heart, or whatever those bloods tell us.
Yep. This is going to make him feel better, and we can also do a lot of tests on this fluid to find out where it's coming from. There we go. Look at that. And that looks a bit bloody, a bit proteiny. Who knows where that's coming from?
As Audrey examines the fluid taken from Harry's abdomen, she's hoping it reveals nothing sinister.
What I'm seeing there is random white blood cells, but not enough for it to be like a pus-type fluid, so it's not infection leaking out into the abdomen. So we've ticked abdominal infection off the list, which is good.
Results from the blood sample taken earlier provide more vital clues about Harry's condition.
White blood cells are through the roof. A few things going on with his bloods. He's got signs of infection and inflammation. He's got signs that his kidneys are getting worse. So it could be that he's got high blood pressure and his kidneys are going downhill, and that's because he's got an infection going on somewhere. I'm going to pop you on fluids and antibiotics.
Sadly, kidney failure in a cat of Harry's age can be a death sentence.
Okay, let's go. It's really hard when you're looking at problems with older cats with multiple problems. He's got heart issues, he's got thyroid issues. You throw in something like an infection, that's enough to tip him over the edge. Yeah, he was lying on that side just now. Good boy. A few things going on with his bloods. He's got signs that his kidneys are getting worse.
In Sydney,
White blood cells are through the roof.
a series of tests has revealed elderly cat Harry has kidney failure, as well as a life-threatening infection.
I've ruled out a lot of things now, so one last step, we're going to do an x-ray and just make sure his chest is clear. Okay.
Audrey is looking for any worrying signs of cancer.
This cloudy bit is all fluid. I just wanted to check the chest and just make sure there wasn't any tumours in there or something we're missing that might be causing that funny breathing that he keeps getting. But the chest is clear, so probably all just to do with the fluid in his abdomen that's just pressing, and also the fact he's got 100 other things going on. X-rays have come back clear. Thank goodness there's no tumours in the chest. We just didn't need another thing to complicate the situation. So back to the initial problem of the kidneys and the infection. Just give me a tiny bit of urine, all right, buddy?
Audrey suspects the infection could be in Harry's urinary tract and wants to test his urine to confirm.
You want to go wee-wee? Did I massage that enough?
But the ailing old cat isn't quite up to it.
No go. We got his carrier. We'll pop him in the carrier and take him home. Hopefully he does a pee in the carrier and I can quickly test that. Out. Thumbs in. Good boy. I'm hoping that we can get away with home treatment, but it is still touch and go. Even though an infection is treatable, because he's got other conditions going on and he's got, age behind him, it really is 50-50 whether he's going to be able to combat all of these things. All right, let's get you home. We're going to have to be realistic and say maybe we can bring him back and maybe we might have to make a call if he doesn't improve.
You're a good boy.
Hi, Kathy. Hello. Come on in. We've been calling you morning auntie, afternoon auntie.
Yeah, everyone.
In Sydney, Audrey and Nurse Bree are returning Harry to Kathy, one of the dedicated carers who's looking after the elderly cat for a seriously ill neighbour.
All right, Harry, let's get you home. He's eager. Okay.
After being diagnosed with a serious infection and failing kidneys, the next 48 hours could determine if Harry survives.
All right, buddy, you know you're home.
All right, Harry.
All right, Harry, why not take him out just yet? So on the blood test, it showed that his kidneys are getting a lot worse. Okay.
Not unusual.
Not unusual in an older cat, but definitely getting bad kidneys also leads to bad blood pressure. So those two go hand in hand.
Okay.
If we can get him back to how he was before, great.
Mm-hmm.
If he decides and his body decides the kidneys aren't going to make a comeback, he just can't get on top of it, then we may have to make a decision in terms of his quality of life.
Okay.
And I'm really not going to be able to tell you which way we're going until a couple of days. If he's not doing well, give me a call.
Okay.
Oh, I think Jackie's calling us.
Oh, great.
Hello, this is Bree.
Hello, Bree.
Hi, Jackie. I'm with Audrey and Kathy, so you've got all of us.
Hey.
Hi, how are you? We're just with your boy.
That's good.
Like her much-loved pet, Harry's owner Jackie is also extremely ill and fighting for her life.
He's been a really good boy. He was very brave for all his tests today. Basically, what we found is that he has an infection. Also, his kidneys are getting a little bit worse as well, and his blood pressure was through the roof. So it is a bit, touch and go for the next couple of days. He's really done well. He's perked up now that we're home.
Oh, that's wonderful.
All right, well, we'll let you get some rest, but we wanted to pass you on the news that he's home safe and sound, and then we'll keep an eye on him over the next couple of days. So you get better and he'll get better, and we'll be in touch.
Okay.
Okay.
All right, Jackie, take care.
Okay.
So we managed to get Jackie on the phone tonight, which is amazing. So we were able to relay the good news that he's home, that he looks a lot better. She was really relieved.
Oh, that's a bit noisy, mister.
But the cat with a whole bag of problems, you never really know how these cases are going to go. He could spring back or he could take a turn for the worse, but he's a fighter, so fingers crossed he makes it over the next couple of days. We'll get you through this and go another couple of lives.
All right, take care, and thank you for doing everything you guys do for him.
All right.
See you, Harry. Be good.
And this week's number one.
Hey, Laura, who you got there?
This is little Oat. He's just come in.
Oh, buddy, you look sad.
Back home in Australia on a break from his London base, Scott has been called into action at the Sydney Dogs and Cats Home.
Have a look at his bottom. It's not good.
Oh, really?
Scott is being assisted by colleague Audrey to treat the badly neglected Chihuahua stray.
Ooh,
Ooh.
that is a big, nasty lump, buddy.
Wow. That is nasty. That's massive.
I've seen a lot of lumps in my time, but this one looks horrible, it's ulcerated, and it looks painful, and I really feel sorry for little Oat.
I know you're busy.
Yeah.
Is there anything you can do to help with that?
Oh, no worries. Well, yeah, absolutely. We'll do our best.
Thank you so much.
Buddy.
Good job.
Come here, little man. Come on, man. All right.
Oh, there's some nasty teeth in there, and that smell.
Whoa, he's got some shocking breath.
Oh, buddy.
Someone's not been brushing their teeth, have they? Oat's breath is disgusting. And when you look inside, you can see he's got some really nasty teeth. The severity of Oat's symptoms means surgery that we're going to have to perform. Sad that someone's decided to dump him at such a ripe old age. Poor little man, he must be so confused and disoriented.
It's really sad when they have them for so long and they just give them up.
Yeah.
You're
Well,
sweet.
two things that has to happen. Are you going to do the bum, or should I do the mouth, or should you do the mouth and I'll do the bum? Neither of them are pleasant jobs.
Scissors, paper, stone.
Go on then.
Scissors, paper, stone.
Oh, scissors, paper, stone. No way! Scissors, paper, stone. Oh, bum. Which one do you want?
Bum.
Okay, right, I'll do the
I'm
mouth.
doing your butt.
I think I got out of that quite well.
I chose to remove the bum lump because one, I like surgery, and two, it actually smells way less down at his bottom end compared to his teeth.
Good boy, all right. Brave boy. It's okay. It's okay. Good boy. Have a little snooze. Yeah? I'll sort you out. It's okay. It's okay. Thank you. Yes, I love you too. It's very concerning as a vet when you see an old dog that needs a lot of procedures doing. Anesthetics are always risky.
Suddenly, Oat stops breathing.
Paddy, stop breath holding. Just got to breathe for him. I can see his heart.
Audrey must artificially breathe for the aging Chihuahua, desperately hoping he'll resuscitate.
Come on, buddy. I've just moved him into surgery. That might get him breathing again.
Scott and Audrey abandoned plans to x-ray Oat. They must operate immediately and finish their procedures as quickly as possible.
Walk him through. Oh, now you start breathing.
Now you start breathing, buddy. Come on.
When it comes to patients like Oat who are elderly and have a number of conditions, with Oat we just need to get in there and get the job done.
And he's such a sweet boy.
It really is.
We need to find him a good home.
Yeah, I'm just glad he's breathing again. Nasty looking thing, isn't it?
Oh, it's gross. It is quite superficial though, so I'm happy about that. So I'm just slowly going underneath the lump and hopefully we can get all of it out. How's the head end going?
Oh, honestly, it's a dentist's worst nightmare. There's a lot of teeth coming out. There's another one.
It's just coming out.
They're just falling out.
Oh, it's so rotten in his head.
I've seen teeth like this many times in rescue dogs. Unfortunately, it's just one of the many parts of the dogs that are neglected.
It's out.
Oh, well
Look
done.
at that. That's an ugly looking lump.
Yeah, as if the bum wasn't ugly, that made it worse. I'm glad it's out though.
Look at that, teamwork.
It's great. Well, look, this guy is going to be so much happier, I think, with all we've done. You've removed his nasty lump, and I've removed a whole bunch of nasty teeth.
Yeah, he's gonna be feeling good in the front end and the back end.
Yeah, so hopefully it's just a case of him now living as much life as he has left. I suppose the challenge of treating a rescue animal or an abandoned animal is you just have no history. So you don't know how long they've been suffering with certain symptoms, you don't know how fast things have grown. So it does make things a little bit difficult because you are flying blind.
And as much as I love you, Scott, I've got to go to an emergency.
Oh, okay.
No rest for the wicked.
No,
So
all right.
I'm going to leave you to recover him.
Sure.
Tell
Okay,
him I
fine.
love him, and I'll see you soon.
I will.
All
And,
right.
and you're leaving me with all the mess.
Yeah, clean up for me.
All right, great.
All right, see
Thanks.
ya.
Bye, Audrey.
Bye.
Check ya.
I've really enjoyed working with Scott. It's not very often that the Bondi Vet team comes together.
You all right, buddy? Hey? Ooh, your breath is so much better now. You can give everyone kisses, can't you? Hey, good boy. Let's go and put you in your bed. Come on then, gorgeous. Here we go, little man. Hey, you can go and have an old man nap.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way.